Hey everyone, Dr. Bodle here, and you might be watching this video because you were having thyroid symptoms, you went to your doctor, they diagnosed you with hypothyroidism, gave you thyroid medication, and all your problems were solved. What a relief, right? Guess we don't have to do the video. Of course, I'm only joking, and I don't mean to make light of anyone's symptoms. We know how significant and severe they can be. But the bigger question is, if you have a thyroid condition, shouldn't thyroid medication fix that? Well, today we're going to discuss why your thyroid medication isn't working for you, and spoiler alert, it isn't because of your thyroid. So if this is a topic that you want to learn more about, and you like learning about natural strategies to help improve your Hashimoto's and hypothyroid symptoms, then don't forget to like this video, subscribe to the channel, and click on the bell for new videos every Thursday. Plus, if you're interested in working with me one-on-one, stick with me until the end of the video to learn more about how you can make that happen. So something that's a common experience for a lot of my patients, and maybe this is something that you've been through too, is in the early stages of their thyroid disease, they're noticing these symptoms, they're noticing not feeling like themselves, but when they check in with their doctor tells them that everything is fine and not to worry about it. This creates a really difficult emotional place. We want to make sure that we're feeling our best, but we have this weird disconnect where we feel like something's wrong, but the expert, the person in charge, is telling us that that's not the case. That's when a lot of self-doubt starts to creep in. Am I actually having these symptoms? Is this something that I'm making up in my head? And also, a lot of you guys out there are super kind people. And I don't think any of us want to be that person that's, a huge bother or a problem patient. And there comes a point where it's like, how many times am I going to have to pester my doctor about this before they, kick me out of the practice entirely? But it's my belief that most people know themselves pretty well. And when things are legitimately changing for them, they're simply recognizing and identifying that change well before their doctor does. Eventually, things usually get bad enough where the signs and symptoms are so clear and obvious that no one can miss it. Your doctor might come back around and say, you know what? You were right. You do have a thyroid problem, which typically isn't a lot of consolation when most people have been suffering for months, if not years. But instead of working backwards, looking at all the factors that might contribute to your specific case of hypothyroidism, and then creating an individualized care plan to help you feel better, the vast majority of people are put on synthetic T4 medication and they're sent out the door. For some people, this can be really helpful, but for a lot of people, it isn't. And when they come back into their doctor and they say, hey, I'm continuing to have symptoms, X, Y, and Z, their doctor will often turn around and say, well, you know what? You have a thyroid problem, and that's just what comes with the territory. This kind of attitude is absolutely maddening. I mean, for years, many people have to move heaven and earth to convince anyone that they're having a real thyroid problem. But now, once that diagnosis has been confirmed, it's like your doctor throws everything into that one box. Oh, you're feeling tired? It's your thyroid. Oh, you're having digestive issues? It's your thyroid. Feeling depressed? Probably your thyroid, but maybe we'll throw an antidepressant your way too. The point is, it's super frustrating when there's a situation that someone was so unwilling to recognize, yet once that situation becomes absolutely obvious, it becomes the answer for everything that's going on with our health without much second thought. Now, there's a few things that I want to note at this point because many times when I bring this whole thyroid medication not working thing up, people tend to have some objections. So I want to be clear that I'm not saying that people don't need thyroid medication. I'm not saying that it's not helpful for a lot of people. I'm not saying you shouldn't work with your doctor, find out what medication works best for you, and also be open to trying different combinations, different formats, and realize that there should be some amount of individualization and personalization with any type of strategy that we use. So if you've worked with your doctor to find the correct type of medication and the correct dosage, and it's helped you to feel a lot better, that's awesome. I'm totally on board with that, and I'm not taking anything away from you. But at the same time, there's a lot of people who don't have that experience. And it's unfair to say to them that, well, here was our one and only strategy that we could potentially apply in this situation. It didn't work, but there's really not much else that can be done. So instead of accepting that they're going to have to just deal with their symptoms, I think a better question is to ask, why isn't their medication working for them? Now, there's going to be a variety of different answers depending on the person. We're going to talk about some of the big ones here in a little bit. But I think no matter the person, we have to consider two main concepts. And the first one is that many people have more than one condition going on at one time. For example, when someone catches the flu, can they have an increase in body pain? Sure. But at the same time you're sick, could you also potentially tweak a chronic knee injury and have that flare up for you? Doesn't sound like a fun situation, but both could definitely be going on concurrently. And it wouldn't make sense for your doctor to say, oh, we're not going to worry about that knee at all. The flu can cause an increase in body pain, so it's probably coming from that. We should identify and assess all the symptoms that you have and determine each one's individual cause, whether they're the same or not. And the second concept is that because our thyroid is involved in all other systems in our body, it's very common that changes in function and physiology in our thyroid pathway can then lead to downstream effects in other areas. So although initially a thyroid problem could lead to a symptom like brain fog, it's possible that if those symptoms aren't addressed over a long period of time, that brain dysfunction can start to become its own entity. So even though we might see improvements in thyroid markers when someone is provided with medication, that spin-off of neurological symptoms that began many years ago now needs its own attention and support. And getting our thyroid hormone right is only a piece of it. So because we can have multiple conditions going on at one time, and because of the connectivity of our thyroid physiology, it's critically important that we assess all aspects of someone's health and recognize the interplay between these different areas. So I think the simplest way to put this is, because of the complexity of our thyroid pathways, although medication can be important, it's only a piece. And if we fail to assess someone holistically, then we're going to struggle to have good long-term outcomes. But now let's look at those specific reasons why your medication isn't being as effective as it could be and why you're still having symptoms. Now, I would like to make a quick note here that oftentimes people think, well, I'm taking my medication, but the effectiveness is being impaired by something else in the body. However, something that I want you to consider is it's also possible that maybe your medication is doing what it's supposed to be doing. Too often, people's TSH levels are returned to normal and their T4 and T3 levels look fine. But because they were diagnosed with thyroid conditions initially, they think, well, if I'm not feeling better, then the medication needs to be altered. Maybe I need a higher dose. Maybe I need a different format, as we discussed before. But remember what we just said. It's possible to have two different things or more going on at the same time. And it might be worth considering that maybe there isn't any issue with the medication. Maybe our thyroid pathway is working better for us. But at the same time, you could be continuing to have symptoms because those symptoms are being caused by something else. So now I'm not saying that this is the case for everyone, but we do want to consider all possibilities as we work to help you improve. So the first big reason why your medication might not be as effective as it could be is due to Hashimoto's and or other autoimmune conditions. I very regularly get asked, how is it possible for someone to have symptoms if their TSH, T4, and T3 are normal? And Hashimoto's is a great way of explaining that, both on the front end, when someone has antibodies but they haven't had enough progression of the disease to change their TSH and T4, and also on the back end of the condition, after they've been diagnosed and provided with hormone replacement. You may have heard me talk about this before, and it's the difference between thyroid hormone utilization versus the quantity or the amount of thyroid hormone that is present in the system. Yes, of course, we need enough, or we need the amount of hormone to be right, but if our body can't transport it and bind it to the cellular receptor, then we aren't going to have any effect from that hormone, and therefore it doesn't do us any good. This is why in the beginning of the disease, even though the gland is mostly intact, due to antibody activity and damage to the gland itself, we can start to develop a low-grade inflammatory response. Inflammation impairs the way our body uses hormones, and thyroid hormones are no different. So even though your thyroid gland is still making enough, it's the autoimmune aspect of things which then leads to symptoms. Over time, Hashimoto's will progress, and the damage to the gland will become worse and worse. Eventually, we'll get to a point where the gland can't make enough thyroid hormone. That's when we see the TSH go up, the T4 levels drop, and this is when most doctors will catch it. But once that happens, what's the strategy? Well, it's to give you replacement hormone medication to replace the hormones that your gland is no longer making. And this is important. And we don't want someone to be chronically low on their thyroid hormone. That's not healthy for them. But once you get that medication in your system and you get those T4 levels back up and your TSH is managed by this point, in a way, we're kind of back at where we were in the beginning. The amount of thyroid hormone is fine. The combination of what your body can make with the medication you're now taking has managed that issue for you. But the reason why it's similar to those initial stages of Hashimoto's is because, once again, we don't have a quantity problem, we have a utilization problem. The thyroid hormone medication is just there to replace. It doesn't do anything to manage the autoimmunity. So if we haven't used some strategies to lower those antibodies, lower the inflammation, and support overall immune system function, then we're going to continue to have those low thyroid symptoms because our body can't use the thyroid hormone that it's being provided. So if you've had thyroid symptoms for many years, you were put on replacement medication and it didn't make a huge change for you, then consider getting TPO antibodies and TG antibodies checked. And I also find it useful to check some of those main inflammatory markers, including C-reactive protein, fibrinogen, homocysteine, uric acid, ferritin, and also vitamin D. Determining whether or not you have thyroid autoimmunity is a key aspect of approaching thyroid conditions in general, and we want to make sure that we do the testing and investigation necessary to confirm this one way or the other. Next on our list is anemia. And if you Google signs and symptoms that are associated with anemia, it's going to look very similar to many of the symptoms that are associated with low thyroid. The reason for this is because with thyroid hormone, it affects all systems in the body. And when it comes to transporting oxygen, that's something that every cell needs as well. Anemia can be defined by a decrease in red blood cells, hemoglobin, or hematocrit, and is most commonly caused by a deficiency of iron, B vitamins, or an increase in inflammation. Common causes of those issues includes heavy menstruation, GI bleeds, poor absorption in the gut, either due to inflammatory gut conditions like celiac disease, IBS, ulcerative colitis, or Crohn's disease, or by taking certain medications like proton pump inhibitors, which can impair the digestive environment. And although our thyroid is heavily involved in all these different areas, you can likely take thyroid medication until the cows come home, but you're not going to see improvements in things like fatigue if it's primarily being driven by something like anemia. You're probably starting to understand things pretty clearly by this point, but this is why it's so ridiculous for doctors to only check TSH as part of someone's thyroid management. It's possible that that same person could have low hemoglobin, and if you just run a CBC in tandem with the thyroid panel, you'd be able to pick that up and say, you know what? Some of your symptoms could also be coming from this anemia that hasn't been addressed, and we need to loop that into your care plan if we want you to feel better. Anemias can be tricky because not only do you likely need to support any type of nutrient deficiency, but you also need to support the underlying cause of why that deficiency is occurring. So if you need iron, or you need B12, or you need some compounds to help you lower inflammation, do that. But also make sure you're supporting your gut, your hormones, whatever it might be, that way that problem doesn't continue to reoccur. The next reason why your thyroid medication isn't being effective is due to changes in our stress response and blood sugar regulation. We all have to manage our stress, and some people have a higher tolerance for that than others. However, if we already have a thyroid issue, that's going to be an internal physiological stressor that is going to make our capacity for dealing with other stress a little bit lower. This means that people with thyroid problems are at a much greater risk for developing these abnormal stress responses and changes in blood sugar stability. And I think this is a huge part of our health that often gets overlooked, even by practitioners who are making a primary focus of theirs to address your nutrition. I made a video recently specifically on this topic. Most people didn't see it because I released it on Thanksgiving, which probably wasn't a good idea. But if you have some interest, I would definitely check it out, especially if it isn't something that you've considered before, as it could be a massive piece that you add to the rest of your strategies. The hard thing here is that these types of changes aren't going to show up on your standard blood panel. Oftentimes, people's fasting blood sugar looks normal, their average blood sugar may look normal or maybe slightly elevated, and although some people may have elevated triglycerides, most will only see those triglycerides above what is optimal, which is something that isn't picked up by most practitioners. If you really do want to get some extra insight into this aspect of your physiology, then an option would be doing a salivary cortisol test, where you get multiple samples throughout the day, compare those levels to a standard cortisol rhythm, and also look at the total cortisol production over a 24-hour period. I do find these tests helpful for those people who really want to know, but I don't run them all the time. And the reason for that is sometimes it's better to save people's money and determine where they're having cortisol and blood sugar changes based on their symptoms. The way that I do that is I ask people whether they notice changes in energy or function based on the timing of when they eat. So if you go a long time without food and you start to feel functionally worse, then that could be an indicator that your cortisol levels and fuel levels are dropping lower than they should be. If you then eat and you see a resolution of those symptoms and you feel better and more energized, then that only adds to the confirmation. Additionally, if you find that after you eat, you feel sleepy, tired, and drowsy within about 30 minutes of that meal, that's another indicator that there could be changes in this part of your physiology. The bottom line, we should be able to eat and be hungry beforehand, not hungry afterwards, but not notice any other changes in how we feel or any changes in symptoms. If you're already eating a clean whole foods diet with lots of healthy protein, fats, and fibrous vegetables, but you're continuing to have these spikes in stress and changes in symptoms around meal times, then you need to heavily consider that there could be emotional stressors in your life that are leading to these changes. On the other hand, if your stress levels are fairly well managed, but you're eating a very highly refined and processed diet, then you should work to clean that up first and see if that helps you to make improvements. No matter the cause, if we're having changes in cortisol, whether too high or too low and abnormal cortisol timings, plus we're having blood sugar fluctuations on top of that, these can become a regular and consistent irritant to the system, occurring every time that we eat or don't eat, and can cause a number of symptoms including fatigue, headaches, brain fog, anxiety, and sleep disturbances. So once again, your thyroid medication might be supporting your thyroid pathways, but it's not going to address the emotional stress in your life or if you're poorly fueling your body. And finally, the last big reason that we're going to cover today is changes in sex hormone function. You might have heard me say before that our thyroid health is critical for the health of our sex hormones. And the reason for that is because sex hormones are an expensive function in the body, and we need to have appropriate metabolism to be able to produce them, transport them, and get them to where they need to be. And I know a lot of people equate things like sex hormones with reproduction, but they are so much more than that. Yes, a lot of people are aware that things like estrogen are important for bone health, but all of our sex hormones are involved in things like maintenance of our gut, the health and recovery of our skeletal muscle, and the preservation and overall functionality of our brain. Why do some women who go into perimenopause suddenly develop depression? It's not because they have a change in neurotransmitter levels. Instead, their hormone levels are declining and their frontal lobe isn't as active as it used to be. So these things are important, and we need to understand how they can affect our body systemically. Some hormonal symptoms are easier to pick up than others. Irregular length of a period or irregular timing of a period, significant pain, cramping, bloating, or headaches, or even PMS symptoms like mood swings, increased cravings, changes in sleep, and also increased levels of anxiety. But some aren't so obvious, and some might look like thyroid problems. That could include changes in digestive function like constipation, diarrhea, bloating, or reflux. It could also be increased levels of fatigue, or even some of those neurological symptoms that I mentioned, whether it be anxiety or depression. The key for me when I'm working with patients is looking at their symptoms and then trying to determine whether there is a pattern to the timing of which the symptoms are occurring. The other possibility, which works for everyone, but can be more helpful if someone's had surgery or is postmenopausal, is looking at someone's life and identifying when they've had large fluctuations in hormones, and then seeing if those symptoms developed after that point. Examples of this would include puberty, pregnancy, or menopause, but also gauging any negative responses someone might have had from taking something like birth control or hormone replacement medication. Testing for sex hormones can be difficult, And although I will do blood labs for people who are postmenopausal, where we'll check progesterone, estrogen, and testosterone, if someone's still having menstrual cycles and those hormones are abnormal, then even though we can use certain dates during someone's cycle as reference points, it's hard to know if their cycle has shifted one way or the other, and if we can actually trust those reference points. To support these areas, because sex hormones are downstream from a lot of other functions in the body, I will often work to make sure that someone is getting enough protein, they've got a lot of healthy fatty acids and omega-3s in their diet, do things to support their gut, make sure they're having regular bowel movements, potentially supporting detox and biotransformation pathways, and also ensuring that they're getting regular sleep and doing exercise that they tolerate. Although it seems a little crazy, oftentimes when you get these other areas in order, the hormones start to fall in line. But if we do need extra help and want to take that next step with testing, then once again, I do like to use salivary testing where samples are taken on a regular interval over the course of a month. This allows us to see where the hormone levels are at, but also it shows us the timing and the relationship from one hormone to another. Just like with thyroid hormone, sometimes the issue isn't that we don't have enough in our system. But because the menstrual cycle is a choreographed dance where changes in one hormone leads to changes in another, this type of testing can give us a much more complete picture and allow us to address your particular needs more specifically. Of course, when it comes to sex hormones, we always want to be careful and make sure that someone doesn't have any structural or pathological conditions going on, whether that means different types of cancers, fibroids, blockages, or endometriosis. But if we're following up on your symptoms and those things are cleared, then even though it can be a challenge, by addressing certain lifestyle and nutritional factors, these parts of our health can be dramatically improved, which not only reduces symptoms around the sex hormones, but then feeds back and can support better thyroid health as well. As always, your body is a total system where everything works together, and treating it as different parts or separating it into different pieces and only checking 1 or 2 lab markers because that's what you've been diagnosed with and that's what we've decided to focus on isn't going to do us a lot of good and isn't going to help you make lasting change. So although you may have a thyroid condition and although you may or may not need medication, recognize that there are these other areas that can also have tremendous impacts on how we feel, and make sure that your doctor is helping you to support them if their first line strategy isn't being effective. But I hope that you enjoyed today's video. I've been getting a lot of questions about these specific topics, so I wanted to make sure that I addressed it in a comprehensive way, just like we're supposed to address our health. And I hope that it helps you to continue to make improvements along your health journey. If you have any questions, comments, or feedback, make sure to drop them in the comments below. If you like today's information but know that you need more help and you're interested in working with me one-on-one, either in person or virtually, then you can start that process by sending an email to contact@seattlethyroidhelp.com. Once my staff hears from you, they'll reach out, make sure that you qualify for a free consultation, and then help you get on the books. During the consultation, it's absolutely no pressure. I just want to learn more about your health and figure out if I can help you. If I think I can help you, I'll let you know more about what that looks like, and if it feels like a good fit for both of us, we'll move forward together. If you're not ready for the consultation but you want to keep learning, then I'd recommend checking out some of the playlists on my YouTube channel, following me on Instagram or Facebook, or by grabbing either one of my free downloads, which are listed in the description box below. But that's all we have time for this week, and we probably went a little bit over time, but thank you for watching, thank you for commenting. I love you guys, I hope you're doing well, and if you do like the videos, please remember to like and subscribe. But my name is Dr. Brad Bodle. I hope you guys have a great rest of your week, and I will see you in the next one.